Good afternoon. Our aim with the research challenge is really pretty simple. We know, as do many of you, that what takes place on social media with regards to healthcare can be very important. But even though as valuable as that is to furthering our understanding, it's still an area that's underserved by researchers, and we feel that it really deserves much more attention. The design of the research challenge is unique in that we wanted to see everyone included. So we invited doctors and academics and patients and caregivers and nurses and really all the stakeholders within healthcare to submit research proposals. And we got a lot, quite a few, from individuals and from groups from around the world. Ultimately, there were 4 teams composed that were selected to be finalists. And those teams consisted of 30 individual researchers, had access to a ton of data, and they ran more than 2,200 reports on our analytics platform, Simpler Signals. The areas of study, as you can see, really varied widely, everything from mental health to self-tracking and everything in between. And then the 4 teams, they turned in their research abstracts, and those abstracts were then judged by an independent peer review panel that was made up of Kevin Clausen, Damian Rowland, and Urmimala Sarkar. And I want to really say thank you to the judges for all their time and effort in this. It's very much appreciated. The title of the winning abstract is #WeAreNotWaiting, I Want Life. The Medical Device Hacking Patient Movement. And this is the winning team, and I want you to notice that what's so cool about this, we have 6 team members from 6 different organizations that came together to do this study. And here today to represent the team, I'd like you to join me in welcoming Michele Litchman.
Thank you. Thank you, Tom. I am so excited to be here to represent our team, and I want to tell you a little bit more about our team. Looks like my slide deck's not up yet. I want to tell you a little bit more about our team. So we had Heather Gable, who is an e-patient and also a researcher at the University of Illinois, Chicago. We had Mariana Gomez-Hoyos, who is a diabetes educator and also a patient advocate who lives with type 1 diabetes and works for Beyond Type 1. We also have Perry Gee, who is a nurse scientist at Dignity Health. And we had Dana Lewis, who is here as a patient and a technologist from OpenAPS. And then we had Caroline Fitzgerald, who is a designer and also an occupational therapist from the Hope Lab. And so, looks like my slides aren't up yet, but one of the things that we did was we actually looked at 2 different hashtags. We looked at We Are Not Waiting, and we looked at OpenAPS. And when you look at data on Simpler, one of the important things to know is that when the hashtag starts being used by individuals within the Twitter community, it doesn't necessarily mean that it's always captured immediately, and it has to be registered with Simpler. And so one of the things that we found was there were probably lots of tweets going out that did not necessarily get captured within our project. We had over 6,000 tweeters. We had over 94 million impressions related to the 2 hashtags. That was over a period of since 2014 and to current. And so you can see that there were 6,000 tweeters with We Are Not Waiting, and then about 1,700 related to OpenAPS. And that generated over 40,000 tweets, which is really exciting. It was a lot of data to analyze. So this conversation occurred over 142 countries in 24 languages. And I think that is such an amazing thing to see, that this is not just something that's happening here, it's a global movement. So one of the things that's important about this slide, I know that you can't see all of the green boxes individually, but one of the things that we saw with these spikes in tweets, the blue represents We Are Not Waiting and the orange represents OpenAPS. One of the things that we saw when the data started being captured by Simpler is with every spike that you see, we could identify something, a sentinel event that related to that. That might be a JAMA publication. It might be actually this MedX conference where there's a huge surge in activity related to the conversation around OpenAPS and We Are Not Waiting. One of the things that we found that we were really excited about was how positive the conversation was. So you can see that it's pretty similar for We Are Not Waiting, which was 85% positive, and Open APS, which was 82% positive. So what that means is there's a measure of sentiment. So how the words that are used in a tweet, it gets measured on a -6 to a +6 scale. And we can go in and we can actually adjust the words that we need to make sure that we feel like it's being accurately represented. We had to actually change a couple of words, like the word hack and the word rig were originally denoted as negative, and we had to change those to being more neutral because that was what the conversation was around. But one of the things that we found related to analyzing the positive tweets was really people wanted to live their life without having to modify. They really wanted to be able to go to sleep like somebody without diabetes and have a peaceful sleep and not to have to worry about having a low blood sugar or any of the other things that might disturb their sleep. One of the other things that we gathered from the data was this kind of mission of hope for the future, hoping for a better life. And when we looked at the sentiment for negative information, one of the things that we were looking for actually was people who were saying people shouldn't do this. But what we actually found was people just talking about frustrations with kind of the current healthcare atmosphere with regards to what devices are available, and then troubleshooting technical difficulties. So there weren't a lot of tweets out there that saying overtly, we should not be having this movement. So I think that's really fascinating. The other thing we did was we looked at personas. So initially, part of our team looked at 200 most tweeted photos and kind of looked at what ideas might be generated from them, and then we had the designer on our team kind of develop personas related to that. So one of the 6 personas is fearless leaders. So these are people who are kind of taking the reins of this movement of kind of this making your own health movement. And then we had the loopers who are just living it up. So the people who are actually using this technology to really augment their own health. We had parents on a mission who refused the fact that the technology didn't support the health of their children. And so they were on this mission to make sure that the health of their kids were better. We had the tech titans who were really approaching industry and healthcare tech companies to try and make sure that they knew that this was in the process, and they wanted to make sure that new technology coming out in the future really was patient-centered. There were the movement supporters. So actually, the majority of the tweets were just people who tweeted a couple of times. It wasn't somebody who tweeted as much as maybe Dana Lewis would tweet. I think that one of the things that's important is for a movement to actually take flight is you have to have a lot of participants who are actually supporting this movement. And so there definitely was in this analysis that we did. And then finally, I think it's really important to note that there were several healthcare provider advocates. There were physicians, there were dietitians, there were nurses and nurse practitioners that really felt like this was really important, and they wanted to see this moving forward. So I guess in conclusion, I want to just say the diabetes community isn't waiting, and are you? Thank you.